Hi friends, welcome back to my channel. I'm Hope and I help you cut through the prenatal and postnatal bullshit advice so you can understand your body with evidence and not fear. So let's get into today's topic. Okay, if you have ever been pregnant, you have probably heard somebody say your abs separate during pregnancy. Like that is something really catastrophic happening inside your body. However, the truth is much less dramatic. Your abs are not ripping apart, they are not snapping open, and they are not leaving some huge gaping hole. What's actually happening is far less terrifying. And that is my aim for this video for you today. The connective tissue between your abs, which is called the Linea Alba, gradually stretches to make space for your growing baby. This comes straight from high quality ultrasound data, where a study followed pregnant people throughout pregnancy and postpartum. They found that the inter-rectus distance, the IRD, which is the space between your six-pack muscles, increased slowly and predictably across pregnancy. No tearing, no trauma, and definitely no broken core. This is a normal mechanical adaptation to a uterus that is getting bigger every week. A lot of fear-based fitness language treats an increased IRD like a pathology, like widening equals damaged or stretching equals weak. But that is not what the evidence says. A 2019 systematic review looked at the relationship between IRD and things like lower back pain, pelvic floor dysfunction, daily function, and quality of life. They found no consistent evidence that a wider IRD predicts any of those outcomes. So let me repeat that clearly. A wider IRD does not automatically mean pain, dysfunction, or a broken core. And a 2018 systematic review made another key point, that even postpartum IRD is not a strong predictor of core dysfunction, and evidence for fixing IRD with specific exercises is low quality and inconsistent. So during pregnancy, the widening is normal. Your abdominal wall is literally doing its job. So let's talk about why language matters. Words like separated, torn, split, broken, they create fear, they create urgency, and they make pregnant people believe that their body is fragile and that it is simply not supported by research. A 2020 qualitative study interviewed physiotherapists and midwives about how they talk about IRD. They found that professionals who used fear-based, damage-oriented language had clients who became anxious, movement avoidant, and hyper-focused on their abs. Professionals who used neutral, adaptive language, such as your abdomen is making room, had clients who moved more confidently. So yes, language really does matter. It shapes how you move, how you feel, and how much trust you have in your own body. When we say your abs are separating, people imagine injury. When we say your connective tissue is stretching, people understand that that's a normal, reversible, physiological adaptation, just like how your rib cage expands or your skin stretches. There's a huge difference. So what is your core actually doing during pregnancy? Let's break this down anatomically. Your core isn't turning off, it doesn't stop working, and you're not suddenly left without support. The Linea Alba stretches and thins, but it still transmits force. Even through IRD increases, your abdominal wall still transmits force, just differently. Studies show that changes in force transfer depend on tensioning of the Linea Alba, not just the distance between the muscles. So it's not actually the width, it's the tension that matters. As your abdomen grows, the rectus abdominis becomes more vertical, the obliques wrap more around the sides, and the diaphragm gets pushed up, and the pelvic floor manages increased load. But they are still active, they are still coordinating, and they are still stabilizing. Trust me, if your core was broken, you would be needing a hospital visit. Now, you may have noticed different demands on your body during pregnancy. Your balance might have changed, your breathing might have changed, your abdominal pressure might have changed, and you recruit muscles differently. These are adaptations, they are not failures, and the research is very clear on this. Increased IRD during pregnancy does not inherently reduce abdominal muscle function. So, does an increase in IRD mean that you need to avoid certain exercises? Probably not. The research shows us that no exercise has been proven harmful for IRD during pregnancy, no exercise consistently prevents IRD, and no single exercise has been shown to cure IRD. Now, what matters most is how the exercise feels, whether you can manage pressure, whether breathing is coordinated, and whether you feel supported and safe. That's it. If you feel discomfort, you modify. And not because you're breaking anything, but because you are choosing comfort and efficiency. Here are your key takeaways for this video. A wider IRD in pregnancy is normal. It happens to almost everybody. It does not predict pain or dysfunction. It does not mean your core is broken. Fear-based language harms more than it helps. Your core is adapting, not failing. Pregnancy is not a pathology. You're not fragile, but you are adapting. Remember, it is your body, your choice. I'm just here to help you make informed ones.